Okay, so let's go over this pamphlet that they gave me. This is a pamphlet made by the Cornell Feline Health Center, Cornell University College of Veterinary Medicine, and I spent a lot of time at Cornell University. I did not attend, but I spent a lot of time there. And this is called Feline Lower Urinary Tract Disease. Now, anytime you hear the name of a disease, all it is a name for a collection of symptoms. So I feel like what they're doing is they're trying to make this more scary. So instead of having a urinary tract infection, your cat has feline lower urinary tract disease. The name of every disease is only a name for a group of symptoms. The reality is that diseases do not exist. The symptoms exist, but the diseases are only a name for a group of symptoms. And that is why conventional medical doctors do not have any cures for any diseases. All they ever do is treat symptoms. The reason why is because a disease is only a collection of symptoms. It's a name for a group of symptoms. In order to get rid of the symptoms, you cannot treat the symptoms. You have to go to the underlying cause of the symptoms. And when you go to the underlying cause of the symptoms, you're not treating the disease. You're basically only eliminating the cause of the symptom. And when you do that, you realize, well, diseases don't exist. Because once you eliminate the cause of a symptom, the symptom goes away. And when the symptom goes away, you no longer have the group of symptoms that is classified as a certain disease. Now, some people will understand that and some people will not understand that, and that is perfectly fine. So when I get a pamphlet like this that says feline lower urinary tract disease, I kind of have to laugh at it. And then here it says, get the facts on signs, diagnosis, and treatment. And once again, they're only treating symptoms. It says feline lower urinary tract disease, and they call this FLUTD, covers a range of disorders from mild to serious. FLUTD includes abnormalities of the structure and or function of the bladder, the urethra, or both. Surveys suggest that it is the #1 reasons cats visit veterinary practices. Notice it says that surveys suggest. It does not say with any definity that this is the #1 reason cats visit veterinary practices. It only says surveys suggest that. And we all know how wrong surveys can be. Clinical signs. Now, a clinical sign is a symptom. The most common signs of FLUTD include difficult or painful urination, increased frequency of urination, and that's what Boo had, crying out while urinating, blood in the urine, inappropriate urination outside of the litter box, frequent licking of the genital region. So they're saying that if a cat exhibits these symptoms, that they have feline lower urinary tract disease. And remember, a disease is only a name for a group of symptoms. So when a cat has one of these symptoms, as in Boo's case, he only had one of these symptoms, they're now tacking a name on it, and that name is feline lower urinary tract disease. And the name is meaningless because the name does not tell you what is causing the symptom. It's not telling you the cause of any of these symptoms. It's only saying, if you have one or more of these symptoms, we are going to label it this. It says signs of FLUTD often have more than one cause and may be brought on by infections, inflammation, diet, and behavioral issues. And that is exactly why I have a problem with this FLUTD name, because it is not addressing the causes. And the causes could be many different things. It says cats with urethral obstruction will often show the above signs, but will pass little or no urine and will become increasingly distressed. A urethral obstruction is an absolute emergency requiring immediate veterinary treatment. And that is true. That is so very true. And that is why it is so important to not just give symptoms like umbrella names. Everything should be dealt with on an individual and specific basis, because a urethral obstruction is so dangerous. While cats at any age can show these signs, they are most frequently seen in middle-aged, overweight cats that get little exercise, use an indoor litter box, have restricted access to outdoor environments, and drink less water. So what we want to notice in this sentence is that it says most frequently seen. So it's not always the case. It's most frequently seen. And most frequently can be 51% versus 49%. So I'm decoding all of this information for you because I have written similar reports and brochures and stuff like that. I've not written similar literature with regards to cat health, but with regards to other subjects. And I know all of the tricks that are used by, let's just call these PR agencies. It says male cats may be at an increased risk, and stressful environmental factors, including living in a multi-cat household and changes in routine, such as a move to a new home, may also increase the risk that a cat will develop lower urinary tract signs. Again, it says lower urinary tract signs, which is just another word for symptoms. And they're just saying that there can be all kinds of different causes for these symptoms. Diagnosis. Because the signs of FLUTD in cats can have many causes, see below, their origin can be difficult to diagnose. Based on a cat's clinical signs, again, symptoms, a veterinarian will likely perform a physical examination and a urinalysis, which is a microscopic analysis of a urine sample, as part of the initial diagnostic plan. If the cause of the cat's clinical signs is not identified with a urinalysis, your vet may recommend other testing, including blood work, x-rays, abdominal ultrasound, and or urine culture. Common causes. Some of the most common causes of FLUTD include idiopathic cystitis. Now, anytime you see the word idiopathic, it means they have no idea what causes it. And anytime you see a word that ends in itis, it means inflammation. Inflammation is always brought on by acidosis. And in this case, cystitis means inflammation of the bladder, which is a painful bladder condition. Urolithiasis, also called urinary stones, in which solid material forms in the urinary tract, and urethral obstruction, a blockage of the urethra. So they're saying that those three causes are common causes. Idiopathic cystitis. Feline idiopathic cystitis, which they refer to as FIC, is the most common FLUTD in cats. Idiopathic means of unknown cause. FIC is diagnosed when all diagnostic tests fail to confirm the presence of another disease that causes lower urinary tract signs. So basically, they're saying they have no idea. Cats suffering from FIC make frequent attempts to urinate, probably as a result of bladder discomfort, and often are found to have blood in the urine. What I don't like about this is that they're saying the cats are making frequent attempts to urinate, probably, note the word probably, as a result of bladder discomfort. They don't know. They have no clue. And often are found to have blood in the urine. Signs of FLUTD in cats with FIC often resolve within a couple of weeks, regardless of treatment. So most veterinarians treat the condition in an attempt to prevent the signs from recurring. in an attempt to prevent the symptom from returning. Now, if you treat a symptom, it most likely will come back because you're not treating the cause of the symptom. So everything should be focused on eliminating what is causing the symptom. And by giving all of these groups of symptoms names, then it's really just kind of confusing the situation and shifting people's focus away from where it should be. It says stress seems to be an important factor in the development of FIC. Now look at the sentence again. It says stress seems to be. They're not saying that stress is. They're saying it seems to be. They're saying they don't know. Possible sources, and here we go again, possible sources, so they don't know, of stress in a cat's life may include environmental changes, changes in food schedule, and changes in the number of animals in the household. Environmental enrichment and modification can reduce stress and decrease the severity and frequency of FIC episodes. Notice that it says can reduce stress, meaning it can also not reduce stress. It can reduce stress, but sometimes it doesn't. To reduce environmental stress, cats should be provided a safe, clean area in which to urinate, as well as opportunities to express natural predatory behavior. These opportunities may include climbing posts and toys that can be chased and caught. Because changes in food can also result in recurrence of FIC in some cats, a cat's diet and feeding schedule should remain consistent. Notice here how they say result in recurrence of FIC in some cats. So basically what they're saying is recurrence of this group of symptoms in some cats. Once again, they are not addressing the cause of the symptoms. Many pet food manufacturers market diets formulated for urinary health. While these foods may reduce the likelihood that cats with the group of symptoms known as FIC will develop a urethral obstruction, there is no evidence. There is no evidence that they have reduced the incidence of symptoms of FLUTD in cats. So that's a good statement. So it's saying that these specially formulated foods, there's no evidence that they're actually doing anything. And I totally concur with that because when I look at the ingredients in these foods, it's horrifying. Urolithiasis, which is urinary stones. Urinary stones or uroliths are another form of FLUTD. Remember, FLUTD is just the name for a group of symptoms, and they're saying that urinary stones are a symptom. These rock-hard collections of minerals that form in the urinary tract can irritate or even obstruct the urinary bladder, the urethra, or both. Due to the anatomy of the male cat's urinary tract, males are at increased risk of lower urinary tract obstruction by uroliths. X-rays or ultrasound are usually used to make a diagnosis of uroliths. The two most common stone types in cats are called struvite, composed of magnesium, phosphorus, and ammonia, and calcium oxalate. The treatment of a cat with urinary stones depends on the mineral composition of the stones, but surgical removal of stones is often required. So what they're doing here is they're describing a symptom, but they're not doing anything to tell you what is causing the symptom. For cats with struvite uroliths, a veterinarian may prescribe a special stone-dissolving diet to eliminate the stones. If this treatment fails, surgical removal may be necessary. So what they're telling you right here is that even though a veterinarian may prescribe a special stone-dissolving diet, it doesn't work. So the veterinarian is not prescribing a diet that works because in some cases the treatment fails and then you have to have surgical removal. So that's not very reassuring about a veterinarian's practice that they would actually prescribe a diet that does not work. Unfortunately, the percentage of uroliths composed of calcium oxalate has increased in recent years. Unlike struvite stones, calcium oxalate stones cannot be dissolved with special diets, and more aggressive treatment is often needed. Veterinarians may be able to induce the stones to pass by flushing the bladder with sterile fluids. If they fail to pass or if they recur, it may be necessary to remove the stones surgically. So once again, they're talking about symptoms, but they're not talking about what's causing the symptoms. So they're saying the percentage of uroliths of calcium oxalate has increased in recent years, but they're not telling you why. They're not telling you what's causing the increase because they don't know. Cats that have formed uroliths are at increased risk for recurrence. Of course they are, because if they form them once and if you don't change what was causing them, they're going to form them again. And that is why it is so important to address the cause of a symptom and not just the symptom. Because if you don't change what's causing the symptom is always going to return. And that applies to every symptom for every disease. If you only treat the symptom is always going to return. If you only treat the disease, which is just a name for a group of symptoms, the disease will always be there. The disease will always return. You have to get beyond the name. You have to get beyond the symptom. You have to go to the cause to eliminate the symptom and to eliminate the symptom from returning. It says your veterinarian may recommend medication or dietary changes to help prevent recurrence. So at least that is good. Dietary changes to prevent recurrence, that's good. And medication, normally that does not prevent recurrence. The only time medication prevents recurrence is if you're constantly on medication, because medication really does nothing but suppress symptoms. So if you're taking medication for a symptom to not come back, that's all it's doing. It's just suppressing the symptom. It's not going to the cause of what was causing the symptom to begin with. The most dangerous FLUTD in cats is urethral obstruction. The most dangerous FLUTD in cats is urethral obstruction. Okay, so they're saying the most dangerous feline lower urinary tract disease in cats is urethral obstruction. Well, urethral obstruction is a symptom of a cause that is not FLUTD. FLUTD is the name of a group of symptoms. Urethral obstruction is one of those symptoms, and urethral obstruction is not FLUTD, and it is not caused by it. It has a cause that is completely different. Or blockage of the urethra, which is just a name for urethral obstruction. A potentially life-threatening condition. Yes, it is a potentially life-threatening condition. Either urinary stones or urethral plugs may block the urethra. Urethral plugs consist of a soft, compressible material that contains minerals, cells, and mucus-like protein. Intact male and neutered male cats are at greater risk for obstruction than females because their urethra is longer and narrower. Urethral obstruction is a medical emergency, and any cat suspected of suffering from this condition must receive immediate veterinary attention. And that's very true. Get your cat to a vet immediately if you think they might have a urethral obstruction. When the urethra is completely blocked, urine cannot be voided, and the kidney's ability to remove toxins from the blood and maintain a proper balance of fluids and electrolytes in the body is compromised. Now, we have to remember that the kidneys filter toxins from the lymphatic system. So all of the lymphatic fluids in a cat's body are filtered through the kidneys. And the toxins and the metabolic waste in a cat's body are dumped into the lymphatic system. They're not dumped into the blood. The blood feeds nutrition to the cells. The lymphatic system acts as the sewer system, and the sewer system is what eliminates the wastes. You don't go to the bathroom in your kitchen. You go to the bathroom in the toilet, which then drains out through the sewer or the septic system. You don't take a poop in what you're eating. Cells are fed via the blood. Nutrition is fed via the blood, and wastes are eliminated via the lymphatic system. And that is why it is so important to keep kidneys healthy. And that is why it is so important to have proper hydration, because you have to keep the lymphatic system fluid and moving and not backed up and not obstructed and not congested. And you have to keep the kidneys healthy, because the kidneys are what filter the toxins out of the body. So let's go back. So it says the kidney's ability to remove toxins from the blood and maintain a proper balance of fluids and electrolytes in the body is compromised. It's very, very important to keep the proper balance of fluids and electrolytes in the body. If the obstruction is not relieved, the cat's condition will deteriorate rapidly and he may develop life-threatening electrolyte imbalances. That's very true. It's why it's very important to take this seriously. The time from complete urinary obstruction until death may be less than 24 hours, so immediate treatment is essential. But notice that nowhere in anything that I read did they mention what's causing this. A cat experiencing a urethral obstruction may strain to urinate, make frequent attempts to urinate, and produce little, if any, urine. As time passes, an obstructed cat typically becomes distressed, often crying out in pain. Notice in this paragraph, they describe symptoms. That's all they're doing is describing symptoms. Treatment of urethral obstruction usually involves catheterization, which is the passage of a narrow tube up the urethra, but other procedures are sometimes necessary. Catheterization usually requires sedation or anesthesia. After the obstruction has been relieved, follow-up treatment will depend upon the condition of the cat. Dehydration and electrolyte imbalance are treated with intravenous fluid therapy. Antibiotics may be given to combat bacterial infections, and drugs that help restore bladder function are sometimes required. Hospitalization times may range from a few days to several weeks, depending on the severity and duration of the obstruction. And once again, notice in this paragraph, they are only talking about symptoms and how to alleviate the symptoms. They're not telling you anything about what is actually causing the symptoms. For cats that continue to experience urethral obstruction despite proper medical management, a surgical procedure called a perineal urethrostomy may be suggested. Notice that it's suggested, it's not usually mandatory. This surgery involves removing the narrow portion of the urethra, leaving a wider opening through which uroliths can pass. Okay, so basically what they want to do is they want to remove part of the urethra so the cat can continue to experience these symptoms, but they don't want to address what's causing the symptoms. I mean, why not just address what's causing the symptoms so the cat no longer is passing stones and does not have to have surgery? I mean, that's what should be happening here. Side effects of this surgery can include bleeding for up to 10 days post-operatively, constriction of the urethra at the surgical site, urinary incontinence, and a greater incidence of other kinds of bladder diseases. Now, hearing this, like, oh my gosh, that's horrible. For these reasons, perineal urethrostomy is usually considered to be a last resort. Yes, I would hope so. I would hope it would not even have to exist, because in reality, veterinarians should be able to tell us what is causing these stones. They should know what is causing the stones and how to stop the stones from forming. But based on this document that we're reading, they have no clue, because if they knew, it should be included in this document. So they then give us steps to minimize FLUTD. So remember, FLUTD is merely the name for a group of symptoms. So they're giving us steps to minimize these symptoms. Feed small meals on a frequent basis. Manage weight appropriately. Provide clean, fresh water at all times. Provide an adequate number of litter boxes, usually one more than the number of cats in the household. Keep litter boxes in quiet, safe areas of the house. Keep litter boxes clean. Minimize major changes in routine. For cats with a history of struvite formation, feed diets that are limited in magnesium and that promote acidification of the urine. Most commercial diets meet these criteria. Avoid supplementing such diets with additional urinary acidifiers, as over-acidification can cause complications. Consulting with a veterinarian is recommended when making decisions regarding diet. Now, when you over-acidify something, it leads to inflammation. It leads to an itis. So here, once again, they're giving you steps to minimize the symptoms, but they're not telling you how to fix what's causing the symptoms. Prevention. A few unfortunate cats that have suffered from FLUTD will experience frequent recurrences of bladder inflammation, reobstruction, or formation of uroliths. Home care of cats that have suffered from FLUTD is determined by the cause, the cat's condition, and history. Yes, it should always be the cause. Some steps can be taken, however, to help reduce the frequency of attacks and both the severity and duration of symptoms when the problem occurs. See steps to minimize FLUTD above. And once again, they're not telling us what the cause is because they don't know. They're just telling us, okay, your cat can have the symptoms again. And then it says about the Cornell Feline Health Center. The Cornell Feline Health Center's mission is to improve the health and well-being of cats worldwide. Funded solely by the generous support of our donors, we provide up-to-date and expert information to cat lovers and veterinarians, support basic and applied research in cat health, and promote the training of veterinary professionals and researchers. The Cornell Feline Health Center is a unit of the Cornell University College of Veterinary Medicine, and our affiliation with this world-class institution of research and education promotes a unique, collaborative environment that fosters innovation focused on improving the lives of all cats. And here we have a photo of Cornell University, and that's beautiful Lake Cayuga, and that is up in Ithaca, New York. So that is how I look at this pamphlet. I know this video is probably going to upset some people, and that is fine. I'm just sharing this information. I'm putting this out there because it's something we all need to be aware of when we're dealing with the health of our cats and when we're dealing with vets. Now, vets, do serve a purpose. I took Boo to the animal hospital so they could see if he had an obstruction because I don't have the tools necessary to do that. So animal hospitals and vets do serve a purpose. But when it comes to, quote, diseases, I firmly feel that there needs to be a lot of change. So thank you for watching this video, and I hope it was helpful. Thank you for watching this Lucky Ferals video. If you enjoyed it, please give it a thumbs up. Please subscribe if you'd like me to post more videos, and please make sure to check out these other videos that were selected especially for you.